beavercountymentalhealth.com.
Thank you, Noah. We are now joined in studio by guests representing the Mental Health Association in Beaver County, Board Member Tim Finn and Executive Director Craig Cleckley. Did I get that right? All right. Welcome, gentlemen. Let me mic you up here and we'll start talking. Now, I know one thing you want to talk about is you have an important fundraiser coming up, but I wanted to begin by talking about the Mental Health Association in Beaver County in general and the important work you guys do. Can you explain a bit?
Well, let me start off first there, Scott, if it's all right with you. I'm Tim Finn. Hello, listeners out there in Beaver County. And some of you might recognize my name. I'm a retired magisterial district judge. I had offices in Brighton Township serving, Beaver and Midland industry areas.
I voted for you, by the way.
Oh, thank you. Everybody says that. I'm happy to be a member of the board of directors of the Mental Health Association in Beaver County, off and on for about 30 years. I have with us today also our new executive director, Craig Cleckley, and I'll turn it over to him in a moment. But we are hoping to promote all of our missions for the things that we do for the wonderful citizens of Beaver County. It's really heart-rending assignment to be a member of the board of directors of the Mental Health Association. And sometimes you hear some stories that you can bring a tear to your eye. But it's very worthwhile, and I'm happy to participate and help in any way I can. But coming up soon, on Saturday, November 8th, at the center stage in Center Township, we're having a night at the races. Almost every weekend you can find some places holding a night at the races, and we don't think that there's a glut of them out there, but when I started going to a couple of these events are a blast. They are a lot of fun, and it's like going to the track, and you'd be surprised if you haven't attended one of these, the fun you can have at a night at the races. Now, the center stage, for those of you that aren't aware, that's on Old Broadhead Road, down the dip in that road across the street from that car wash. And the owner's Ed Becker. He's a great guy. He's very generous, and it's a nice facility. There's plenty of parking. So it's 7 o'clock on 6 o'clock at November 8th at Center Stage. We'd love to have you there, and you'll have a ton of fun. So I'd like to, if I may, Scott,
Sure.
Can I turn this over to our executive director, Craig Cleckley? He's new on board. We had an opening due to a retirement of a longstanding executive director, and we're real happy to have Craig on board. Craig, you want to introduce yourself?
Thank you, Tim. Yeah, my name is Craig Cleckley. I grew up here in Beaver County. I went to Beaver Falls High School. Fan of WVVP for many years.
Thank you.
Anyway, I went to school at Community College Beaver County for my RN, and I worked 20 years at Heritage Valley down the hill here on inpatient mental health. Loved that job. The fortunate side of this job now that I'm currently in is that I get to see the end results. Inpatient, you see individuals come in sick, they stabilize, they're out, but you never get a chance to see where their life goes. The community, Beaver County, is the greatest support now that I can see some of those end results with individuals. And it's primarily because of the things that go on in the county. They have not let these people drop to the wayside. Mental Health Association there in Rochester and Beaver County is a great resource for individuals that are coming with these challenges. And for a number of reasons, they have people here that care about them. That's the biggest thing. They have people here that advocate for them. Some of the services that are provided there, they have a rep payee service where individuals that cannot manage their finances are given help throughout the month for long periods of time, some of them over 20 years, 30 years. So that's a very nice outfit there. And then there's adult advocacy for individuals that might end up with situations that they can really manage on their own. We have a person that handles that for us, and even for family and child health advocacy, the same exact process there. Skilled, educated individuals that help with that. We also have a Community Connect department where individuals that might have mental health diagnosis are helped to get to their doctor's appointments, to some of their stores, things of that nature, really to help them out in the community. And that's why they're able to function, because of the helping hands that are in place to assist them. And then the part I really enjoy is the peer support, where, as I mentioned, we get a chance to see individuals make it in the world because people have taken their hand, given them instructions, and allow them to live the best life ever, so to speak, for individuals with mental health. That peer support program is very nicely handled there. We also have a Phoenix Center where individuals can drop in for different functions, for singing, playing pool. They're given a warm lunch there every day. And there's
Where's the location of that?
right in Rochester, 105 Brighton Avenue, Rochester, PA. Same, right in the same building that I'm in. And then we have warm line help for those individuals that take place from 6 in the evening till 10 at night. A lot of that is funded through the United Way, some of it. But it's very instrumental because we call some patients on a daily basis to check on them. Others, we remind them of their medication regimen, check on them, side effects, things of that nature, and really give them an earpiece to talk into that shows that someone's out there, someone cares about them. Very nice situation. I got a chance to talk with some of our employees on the warm line, where I did not see a patient in-house for a number of years, but they told me they talked to her, and her response was, well, now that you're in place, I don't have to go in-house. In-house treatment at in-house at the medical center and other facilities are costing over $2,000 a day. But you have individuals that can sort of derail that just by talking to them. So it's a really great feature. I'm glad to be a part of it. And hopefully the county can come out and support us here in the future on November 8th.
If you're just joining us, we're talking with Craig Cleckley and Tim Finn from the Mental Health Association in Beaver County. How does someone get matched with your services or programs? Is there a referral service, or how does someone know if they're qualified or if a relative is qualified?
Yeah, well, there's a number of ways that can happen. Individuals that might go inpatient or receive some of the other services that are provided in the county are referred to us. Also, case management that is set up throughout the county and even inpatient directs them to our services.
Is this for adults only, or are youth involved as well? Or?
Youth are involved also, primarily youth for advocacy. Maybe it's things go on in school or maybe with the doctor's office, some other things. That's what we do with our youth. But as they reach adulthood, those systems are set up to keep them balanced, keep them moving throughout their life course.
Because I read a news item today, a legislature in Berks County, Pennsylvania, proposing legislation to get more help into the schools for mental health. And the number was staggering. I can't remember off the top of my head how many students they think need programs like this, and they're not getting them right now.
Yes, a very large population of our students are being challenged. There's a number of programs throughout the county. There's what they call a YAP group, where individuals in all the school districts get together and handle issues as students. Great leadership in that program. I was able to attend it last month. Commissioners are involved. A lot of student teachers are involved.
Greg, what does YAP stand for?
Young.
Pop quiz.
Yeah. I don't
During the
have
break,
it.
we can look that up. But
we'll
it sounds
look
like
it
a very
up.
worthwhile program.
But yeah, if you ever hear it, though, get involved. It's very nice to stabilize young people that are going through school, whether it's bullying or an illness or whatever.
As far as the Mental Health Association in Beaver County, we're at a time now, especially with budgets, of the federal shutdown trickling down to the state budget level. There's no state budget, so I'm sure funding is something very much important and a concern for you right now.
Yeah, very important right now. We're managing to a degree, but as you mentioned, a lot of issues have come up with feeding some of these individuals. The SNAP program, all those things, we're educating them on what has to happen for them. And like you mentioned, the funding has to take place. It has to come through for our program to be successful. Fortunately, we have good county commissioners. We have individuals at Beaver County Behavior Health. They're stand-up individuals that have been fighting for years. They know how to get the job done.
But that just points to the need of this fundraiser again that you're talking about. So let's circle back to that now and
Well,
how
let me
people can
mention,
help.
Scott, if you don't mind my interrupting, I didn't mention that we have a co-sponsor on this event, and that is Families Matter Food Pantry, and they're a wonderful organization talking about the SNAP program not being funded right now. This is right up the alley for Families Matter Food Pantry. So they are co-sponsoring this event, and we'd like to see a good turnout.
Night of the Races, people may hear that name, but what exactly is that? You said it's like going to the track.
It's really fun. The operator promoter, he comes in with a bunch of taped races. They're not videotaped anymore, but he either has them on CDs or whatever. And they have a system where you can buy a name of a horse, and then a horse is placed in 8, 10, 12 different races through the evening. And the operator, he calls the race like you're at the track, and he names all of these horses, and he randomly selects a particular race, and then the fun begins. The shouting and the screaming and the stomping, it's a blast.
Are you watching the races like on a screen or
Yes,
something?
you're watching it on a large video screen.
Do I have to wear a Kentucky Derby hat? Or?
Oh, you could if you wanted, but you would look funny in it.
We're going to talk more about that event and the Mental Health Association of Beaver County right after this quick break.
Got kids? Too much to do? No time to cook? Download the McDonald's app today and get dinner delivered straight to your door from DoorDash. McDonald's makes it easy for you and your family. Download the app today and get exclusive deals and rewards. McDonald's, I'm loving it.
The NASCAR Cup Series.
Bunched up 2x2. Green flag goes in the air.
Playoff round of 8 heads to the half mile of mayhem.
One car's on its side. Zane Smith rolls over. He flips wildly.
Who will secure their spot in the championship 4?
Here comes Chase Elliott. He will get into Hamlin. They sprint to the line. Checkered flag is waving.
It's the Xfinity 500.
Yankee Trader, Saturday mornings from 10 to noon.
Freedom United Federal Credit Union proudly presents Yankee Trader.
Yankee Trader, buy, sell, or trade.
Yankee Trader is presented by Freedom United Federal Credit Union and in part by Rochester Paving and Seal Coating. Put freedom in your future. Freedom United Federal Credit Union in Rochester. Now thundering through the valley on 4 powerful radio stations. It's Beaver County Radio on 95.7 and 99.3 FM, along with 1230 WBVP and 1460 WMBA.
Thanks for spending part of your Thursday morning with us, 9:48 a.m. at Beaver County Radio. We're joined in studio by representatives of the Mental Health Association in Beaver County, Director Craig Cleckley and Board Member Tim Finn. And we're talking about the fundraiser coming up November 8th, the Night at the Races. But I also heard something about a purse party.
Oh, let me tell you about that purse party. I mean, when I first was introduced to it, I'm thinking, like, really? People are going to turn out to bid on purses? You should see. It's mostly women that attend these things, and it is a heck of an event. We've been doing it annually for a number of years. And oftentimes it's down at the, what's that place in Aliquippa off of Broadhead? Shadow Lakes. And you wouldn't believe what the turnout we get and the fun that most of these women have doing that. So when that comes up scheduled in the event, you see that promoted, get yourself a ticket for that purse party. It's a blast.
And for the Night of the Races coming up November 8th, where are tickets and how do they get tickets? Is there a website, a Facebook page?
Yeah, they're available online, or you can contact our direct office number. Craig will come up with that in just a moment. If you want to buy a horse, it's $40. It's $30 general admission. If you buy a horse, you get to name it. Sometimes these names get a little risque, and it's all part of the fun. So for $40, you would have a general admission and name a horse, or if you're not interested in naming a horse, $30 gets you in. What does that get you? A night of entertainment and unlimited food, beer, and wine.
Right there at Center Stage?
Yes,
at
Center Stage.
Okay.
And on Old Broadhead Road.
Now, Craig, we were talking a bit about Mental Health Association in Beaver County. You were talking about some of the services and programs, and what else can you tell us about, especially this time of year? It's starting to get cold in winter, and it's a time you definitely don't want people, roaming the streets that need help or whatever. And
Exactly. Yes, the weather is changing. Food insecurity is a problem, and individuals really need a kind word. All of us do. Specifically around the holidays, individuals are looking forward to that. One thing I wanted to do is pretty much say thank you. Thank you for the inpatient nursing staff. Heritage Valley has a very nice program there, and a lot of those nurses never leave the floor until it's time to leave, so no one gets to thank them as you would on a medical floor. Also, with the care that is taken care of by our local fire department. Mm-hmm. Very instrumental in helping these individuals meet the challenge. Thank your police officers. They do an excellent job with these individuals. And as far as services and help for the clientele that we're caring for, I think that's the biggest thing, advocating for them. There's a sock drive, there's a clothing drive, there's a food drive. There's always something going on to help, financial drive. And as mentioned, the night at the races that the board members are putting on to help better fund our services. It's a great thing. Say thank you to Beaver County Behavior Health. They're the one that are primarily carrying our program for us, like I said, outside of the United Way. So we appreciate those people. That's the greatest thing you can do, because the people that are established right now need to keep moving. Those hoorays, those thank you will be a great impact on them to keep doing their job.
Now, can you walk us through the process? Like, if you're working with a I don't know if client's the right word, but is there like a sit-down procedure where you meet with them, you talk with them, or are they recommended by another agency, or how does it all? How do you guys get involved? I guess
they're generally referred. We have a person that's in-house under a grant that refers them. He sits there, explains all of our services to them to see how they can match up and how we can help them. Instrumental, that's been going on for about a year, close to a year now, that the county has allowed someone to come in, sit there at Heritage Valley inpatient and care for things. There's other services where these individuals get treatment. Someone comes to help them with their medicine, things of that nature during the day. If they find them out of place, find things out of place in their home, where our services are alerted, and we help whenever we can.
And what's the first line of introduction, I guess, of a relative, if you have a relative or a friend or former coworker or someone you think maybe would benefit from a program like this? Who do they meet with first, or how does that set up?
You could call the doctor. There's local psychiatrists, but they're slim right now, and to get into a psychiatrist's office generally takes 3-4 months sometimes.
Oh, wow.
Yes, so it's very difficult. Inpatient, you could come through the ED, the ER, or reach out to mental health services. That's what that warm line is for, and sometimes we can expedite treatment for you.
Is mental health something that people, I don't want to say take for granted, but they don't quite understand it in many ways? Like physical health, you can see if someone has a cane or a walker, they're in a wheelchair, they're a disability, but mental health, the person you may be standing next to at the store you don't recognize, or does that make it trickier for you and more important for you to do the work you do?
Yes, individuals sometimes find it hard to say that they have a problem. Many of us do. Men do that all the time. They hide their sicknesses, their illness, cover them. The same thing takes place with mental illness. Sometimes you're just not open to accepting the reality. Other times you could pick it up. You can pick it up very quickly if you're trained, where other individuals will try to deviate to escape the notice of it. It is difficult, but thankfully through projects where what you might call more important people that are outstanding, have dealt with it within their families, they seek treatment, and we're more aware of it now because of that very issue. We're all being educated on mental health now. We see the severity of it, the impact of it, and sometimes when things really go astray with mass shootings and things of that nature, it's brought it to light. So it's coming to light at a greater pace now. because people are taking care of themselves. We all have our issues.
Is it being diagnosed more? People recognize there's a...
Yes.
Okay.
Yes. Good treatment, better facilities, and like I said, not just moving through life, but having a greater life. We all experience some form of mental health issue, but recognizing it, getting treated, not being afraid to say that I have a problem or that I'm not okay today. There's nothing wrong with that. So with mature individuals accepting the fact that we have problems, church services identifying problems with individuals, we can conquer this in time. We might not be able to eradicate it, but we can all support each other.
We're hearing from Craig Cleckley from the Mental Health Association in Beaver County, and we're joined by Tim Finn, a board member. Tim is a retired district magistrate. I'm sure that's one of the reasons why you got involved in this program as a board member. What did you see, in your role as magistrate, and how mental health issues, sometimes came to your
Oh yeah, it
courtroom?
came up frequently. It's the people with the biggest problems that create problems for themselves, and you try and have compassion and understanding. Police officers put themselves at risk sometimes in addressing someone that's having like an episode, and it can be very sad. And also even with children. I mean, I did a lot of truancy hearings, and mostly it's not the kids that are at fault. It's the parents that are at fault, and they also collectively have their mental health issues. So it's heart-rendering. It really is.
And so, Craig, people listening right now, they're wondering, man, this is important work. This is an organization I want to help. Touch on some of the things. There's fundraisers, of course, coming up, but are there other, you mentioned like drives or clothing drives, or what's?
Yes, and as mentioned, it's not just the Mental Health Association in Rochester. Beaver County Behavior Health, as I mentioned, has a great program that helps out. There's other staffing that comes from established roots in Swickley area, Staunton Clinic, things of that nature. There's many of resources that the community can help with, so to speak, to keep things moving. I think some of the fundraisers are great. Right now, it's important that they call their representatives to get things moving financially, because just as we see now coming up on a food insecurity for many individuals, that's going to impact everyone in our community. It's going to cause late nights for all of us to make sure individuals are at least fed. The other thing is a lot of people don't understand what's going on with medication for these individuals. Medication is very high. It's premium, but there's newer medications that help very well. Individuals might take medication once or twice a day, and it peaks and dies. You take it, it has a peak period, and it dies. There's better meds out now where you can take an injection that can last 30 days, 60 days, 90 days, and a lot of people are negative towards pharmaceuticals. But they're the ones that are doing the research that's getting us there. When you have better medicines, there's less cost in the hospital, less dollars. The monies can go elsewhere, so to speak. So you have to educate yourself in all aspects of mental health. Medication, some of the food insecurities, advocacy, all those add to the pie, and you have to educate yourself in every one of them.
Okay, and Tim, in the about 60, 70 seconds we have left here, I'm going to throw it back to you one more time. Talk about this fundraiser, how we can help Mental Health Association in Beaver County at night at their races. What do people need to know?
We have two great organizations, Mental Health Association in Beaver County and Families Matter Food Pantry. You can't get bigger hearted than that right now. So come out and have a blast. I'll be there. You can come up and slap me on the back and say, "Hey, Tim Finn, I voted for you," just like Scott did when I got here today. And,
I didn't slap you. Not yet. Anyway.
But come on out and have some fun, and for a good cause.
And again, the website and the Facebook page for people to get those tickets.
Oh, geez.
Well, it's Mental Health Association in Beaver County. I found you right away when I looked it up. So,
and FamilyMattersFoodPantry.org.
And for anyone, you can tell people we've streamed this on Facebook. It'll be on our Facebook page throughout the rest of the week. So if someone missed something or they heard you say something, what did he say? Just go to our Facebook page, beavercountyradio.com, and It's a way to do it. Well, gentlemen, appreciate you spending time with us today.
Thank you.
Wish you a
Thank
lot
you
of
for
luck.
having us, Scott.
Yes, come back again and keep us updated on the programs.
Good to see you again.
You too. All right. Thank you all for listening to the Beaver County Radio Morning Show. I'm out the door. Frank Sparks in next.
You're listening to 99.3 FM.